Why we do stuff. A story of earwax in Vietnam. When I came here and was getting a haircut, my wife was telling me this place, her dad used to go there, but doesn't do it anymore because they raised their rates. I was like, what do you mean? So it's $50,000, $2.50 basically, or less. But apparently they used to clean your ears for free, and now they'll charge you extra for doing that and for shaving. So even though a haircut's still $50,000, in the past they used to give you all these freebies. And the question is, what's the big deal about cleaning earwax? And I find that's the really interesting thing. Cleaning earwax, is it a big deal? Because here in Vietnam, a lot of places clean your earwax, not a professional skill provided by a doctor or a nurse. But in the US, it basically is. I mean, here you see people on the side of the street with somebody shining a light digging into your ear. I'm sure they have pretty clean ears here in Vietnam, whereas in the US, I could tell you from seeing many, many people, we have horribly dirty ears. I mean, the first thing the doctor says is, don't use a Q-tip. I would agree, Q-tip doesn't help, but actually using a little thing and digging and pulling out earwax, I think that's helpful. I mean, it is helpful. It's what the ENT doctor does. But why is it that we don't do it commonly for patients? I remember as a little kid, they had to flush out my ear because I had some little pellets stuck in there. I guess that's probably pretty reasonable. But for most patients, you're like, yeah, you have earwax. Take care of it. Obviously, they haven't been taking care of it, right? I mean, do you see people coming with nails this long? Not commonly. But earwax? Commonly. And the question is, why don't we take care of earwax in the hospital or in the clinic or in general in the medical field? What's the big deal with earwax? Well, let me tell you about why we do stuff. See, I guess people think that in the medical field we do stuff because it helps people. I would say that's a good start. The problem is we always have to weigh that with the risk of hurting people. But I want to say hurting people as a very specific term, but as a general term. Hurting people because we're hurting ourselves. Putting ourselves up for lawsuits, things going wrong, blah, blah, blah. And the big thing with earwax is that there's a lot of sensitive structures there in your ear, like your middle ear, like your eardrum. Like if you poke a hole in it, it's not so fun, right? Sometimes they never fully repair. You don't want to be doing that. But is cleaning earwax really that risky? I don't think so. The problem is the lack of benefit to the doctor, to the nurse. So basically, when I go in and look at somebody's ear, I'll say, okay, have a lot of earwax. Nurse, please clean it out because I can't see the eardrum. I'm worried about ear infection or this or that. I actually need to see the eardrum, otherwise I can't say it's fine or not. So for that case, we'll justify the risk of cleaning out the ear. But usually we'll just run water in it and let it flush out. But if I could see the eardrum and just allow earwax otherwise, would I clean the ear? Well, if they can't hear, then, a lot of wax disturbs the hearing, probably clean it out too, right? You want them to be able to hear. But if neither of those two cases is true, you just say leave it be. Wait till they block up the ear completely, and then they can't hear at all, and then they come in. I remember in training, I saw one doctor who had a specialized setup for cleaning earwax. And you realize, wait a minute, he's an ENT surgeon. Why is he spending half his time cleaning earwax? Because other people don't want to do it? He's better at doing it? I don't know, because I'm pretty sure the person working here at the hair salon who cleans earwax is pretty good at it, right? I'm pretty sure they have very little issues. And the issue is because liability. So much is driven by liability, why we do or do not do stuff. In a sense, you could say we're just lazy, right? We're like, oh, this is a little bit tricky, potentially tricky, I'm just going to not bother with it, right? Like, really, what's the risk? 1 in a million? If even that? It's higher than getting hit by a car when you walk onto the road, right? Why don't we do it? And I would say that's the real thing. We have to think about why we do stuff and why we don't do stuff. And earwax is just one silly example of things we really neglect in the U.S., but most of us have strong justification for why we neglect it. And if you go back as a patient, sometimes you just have to laugh and say, really? That's your reason? That's pretty funny.